Very good morning, or good afternoon, depending on your time zone from where you're joining us today. Welcome to Motivation's first ever virtual event. We're very excited to be welcoming you all here today. Thank you to all of our valued supporters, partners, stakeholders, and staff for joining us live this morning. We'll be sharing a link to this recording after the session today, so I'd also like to extend a welcome to anyone joining us in the near future. For anyone on Twitter during the discussion, if you are going to use and make tweets about the event, please link to us at We Are Motivation. So for those of you I haven't met before, my name's Amanda Wilkinson. I'm Chief Exec of Motivation. I'll be sharing our event today on disability inclusion during the pandemic. Before I introduce the discussion today, I just have a few housekeeping bits and pieces just to share with you. Due to the size of our turnout today, we expect a big audience. Everyone else at the panel will be muted. Your video screens will also be turned off during the session to allow you to see who's speaking and to focus on the panelists. Please feel free to use the chat box for comments. I see people already are using it, which is great. If you have any questions though, please, if you could upload them to the Q&A box at the bottom of your Zoom screens, that would be great. We have planned some time at the end of our session for questions and answers, and we'll try and address any of the questions that we get then. But if we don't have time to answer all your questions, if you could make sure that your name and organisation are clear when you upload your question, we'll be sure to get in touch after the session and respond with an answer. We're, of course, keeping our fingers crossed and hoping that technology is on our side this morning, but greatly appreciate your patience if we encounter any blips or challenges with connection. So to begin our discussion, the COVID pandemic has shown that disabled people have been left behind. Despite some strong progress in inclusive policy commitments by national governments and organisations in recent years, at the time of greatest need during this pandemic, disabled people have not always been included in humanitarian responses or indeed in communications about the pandemic or how they can keep themselves safe. Today, you'll be hearing directly from our regional directors, who you can see on your screen, Biju, our director for South Asia, and Peter, our director for Motivation Africa, about how Motivation has attempted to fill some of the gaps in provision. We'll also be hearing from partners, service users, and staff about their experiences over the past few months, and these experiences will be shared by video. Most of you I know Motivation very, very well, but for those of you new to the organisation or perhaps hearing from us for the first time, Motivation designs wheelchairs, services and training for disabled people and their communities in low and middle income countries all around the world. Our projects are designed to ensure that disabled people are able to fully participate in their own communities by giving them the tools they need and by training and influencing those around them to include them sufficiently and appropriately. But we're not a humanitarian organisation, and our expertise is not in emergency response or relief. So the activities that we have developed during the pandemic and over the last few months have been informed first and foremost by our service users, and then implemented hand in hand with our network of partners on the ground in the communities where we work. We hope that today's event will give you a picture of disability inclusive responses to the pandemic, but also help to share some of our learning that we've amassed over the last few months. So to begin, to give us this insight, can I turn to you, Peter, for our experience in our African focus countries? Thank you.
Thank you very much, Amanda, for the opportunity, and a good morning and a good afternoon to all attending this session. Very pleased to share with all of us the situation in Africa. My name is Peter, and I'm coming to you from Nairobi, Kenya, the regional office for motivation, where I work as the regional director. Motivation has worked in the region for slightly over 20 years, giving support and empowerment to our partners and also to people with disabilities. Currently, we focus on 3 countries, that is Uganda, Malawi, and Kenya. Specific to the agenda of the day, I would start by saying all was going on well and normal until when COVID-19 was first announced in the region. Actually, at some point before this announcement, there was always a feeling that this was a virus that would not actually come to Africa, and everyone felt safe and no one gave any deep thought on the matter, and especially the disability sector. When the reality dawned that COVID was with us, this is what I would personally call fear and panic. And people did not know what to do. And in many occasions, the communication, the information, and the responses was actually quite confusing. Now, due to lack of adequate information, many disability organizations retreated, leaving a gap on an inclusive response. But after about 2-3 weeks, when things were getting clear, the disability caucus in various countries started to engage with their government to ensure an inclusive approach to this pandemic. At Motivation, we noted a very big gap since no one was actually reaching to our project service users to know and address their needs as a result of this pandemic. For that reason, we mobilized our team members who started contacting and calling these users to offer support and also to know what were their needs and how they thought they could be supported. We noted with a lot of concern the challenges that people with disabilities were actually facing. And this was first-hand information on the basis of the calls that we were making. And I would be very happy to highlight some of the challenges that were communicated to us. Number one is about difficulty of socially isolating. Then things to do with hand sanitization stations or water or places where people could actually wash their hands. They were too high and users could actually not be able to access them. Then there was also lack of sanitizers to clean up the devices, for example, the wheelchairs that people are using. Lack of access to food and medical items was actually very pronounced. Lack of proper information about COVID on how to stay safe was equally something that was coming out very, very clear. There was a lot of information in the social media, but in many occasions, we couldn't really be able to understand how accurate that information was. Then awareness on the availability of support services to persons with disability was also not very, very clear to the many people that we talked to. So through these calls, we learned a lot. And going forward, every response that we are currently making is purely based on the needs that were clearly expressed to us. And a good example is one of our service users in the name of Catherine, whom we talked to and was happy to record a video with us just to give us an idea of the kind of information that we have been getting through the calls that we've been making. So at this point, I'm inviting us for a few minutes just to watch this video, and shortly after that, I'll come back and continue with the experience that we have in the region. Thank you.
My name is Catherine Wayego Kimani, and in relation to motivation, I'm the motivation peer trainer here in Kenya. I have been using the motivation wheelchair since 2016. When it comes to the pandemic, it has really affected us in a very big way because one, we need to sanitize our hands every now and then, and getting the sanitizers and the hand washes. It's not easy. And also, for me, it has affected me in a big way because I used to do business. I used to sell second-hand bags, ladies' bags. But now, since the pandemic started, I'm not able to go get them from where I used to go because it's a big market where there are many people there. People, you don't know if they are affected or not. You don't know if they are sick or not. There are people who are lacking food because they are locked in the house. There are people who are lacking, they are calling us, telling us that they don't have the essential things they use every day, like diapers and catheters, but they can't get them. And when you go to buy them, they're even more expensive than they used to be. So people are really suffering at their homes. When it comes to motivation, they've really been supportive to us because even if we can't meet, we're having Zoom meetings every now and then. We're having Zoom meetings every now and then. They are calling us to encourage us. They are encouraging us to call the other people, the other wheelchair users, hear their problems. If there are problems that we can solve on phone, we are doing that. Motivation has been there for us since the beginning. Even now, they are there for us. If you have a problem, you can call anyone in motivation and they'll help you out. When we are in these Zoom meetings, when you talk to each other and we encourage each other, you feel like you're not really alone. And yeah, I think the Zoom meetings have been holding us together and giving us enough support to move on. Without motivation, I wouldn't have met so many people who are like me. Without motivation, I wouldn't be a peer trainer. So I think it's very important because it brings us together, brings our problems together, and get to solve them together too. Yeah, motivation is really important. It's part of us. Without it, I don't know where we would be.
Well, Catherine's story is one out of 1,500 stories that we have been able to contact through the phone calls. And this actually confirms that the phone calls that have been made, they have been really beneficial in the sense that many of the people we have talked to, they have felt cared for just by those calls. And then at the same time, we've been able to establish what kind of needs the people are going through. So far, we've been able to make some sizable. I'll be very happy to talk to us through a few of these achievements. The first thing is that we have been able to make contact of 1,500 beneficiaries with whom we've had a conversation. The second thing is that we've been able to deliver what I call the peer-to-peer support through the phone calls and again through the Zoom meetings that Catherine has talked about. And so far, we've been able to do this to about 100 wheelchair users. At the same time, we have been able to link about 200 wheelchair users to other service providers for specialized support, especially where we know that services are being offered in a safe way. And again, due to lack of genuine information about COVID-19, we've been able to develop information packs and contextualize the same for each of our country to help our beneficiaries with accurate information. Partners in wheelchair services have also been sensitized on the need to offer service in a safe way. And again, number 6 is that we've been able to come together with the rest of the disability organizations in our respective countries to kind of form a consortium whereby we can be able to advocate for an inclusive approach in the pandemic. Going by the data that we are getting from our respective governments, that is Kenya, Uganda, and Malawi, and also going by other bodies in the world who have got an authority to speak about COVID-19, it comes out clear that the peak for COVID-19 in Africa is yet to be seen. And actually, for example, for Kenya, the numbers currently seem to be going quite high. There's a very high possibility then that the peak could be experienced in October and November, and hence the reason for why some government like Kenya again have decided that 2020 schools are likely going to reopen in January 2021. With that in mind, it comes out clear that our efforts towards COVID response is likely going to be longer than expected. The impact for COVID for people with disabilities is likely going to be worse in the days to come, and therefore more shall be needed. Now, due to these realities, we have realized that we cannot be in this alone. The need is too huge for one organization, and we have therefore been working with other organizations to lobby for more support for the disabled people as clearly described by one of our partner organizations, UDPK, and the Chief Executive Officer, Anderson Gitonga, will be speaking to video, and thereafter I'll come back to continue giving the experiences in the region. So welcome for the short video.
My name is Anderson Gitonga, and I'm the Executive Director of the United Disabled Persons of Kenya, UDPK. UDPK is the Federation of DPOs. DPOs are Disabled Persons Organizations. So we are an association of the various disabled persons organizations in our country, and we bring them together so that we can speak in one voice in terms of advocacy issues. We have been working with motivation in quite a number of ways. Number one, I said that we are a disabled persons organization. We are DPO, and we are the national umbrella organization. And we realize that as DPOs, there are many things that we cannot do because we are limited. So we need other partners. So for example, we've been having what we call the Caucus on Disability Rights and Advocacy, which constitute the DPOs and non-DPOs, the non-state organizations like Motivation, who are key in terms of offering a specific service. So they're also included in our lobby work. And the relationship has been very, very good. They have, in a big way, influenced how we do advocacy in this country. The situation is, of course, very, very worrying, and we don't have answers. But the much we've been able to do is to rapidly create awareness among us, communities and persons with disabilities, lobby with the government as a duty bearer to ensure that the interventions that they are carrying are inclusive, and also strengthen our DPOs to be able to lobby at the various levels, at the county and community level, to push for the inclusion in service delivery.
Wow. Working with others in advocacy, we have seen very good results, as clearly described by Anderson. But at this juncture, I'll be very happy to share with us just a few results that we've been able to see. The first one is that advocacy, the media houses are highlighting the plight of persons with disabilities. And with that, more support and allocation is actually being seen, because through the media, persons with disabilities are becoming much more visible in the current state of pandemic. And because of that, we have seen the government taking time to listen and address some of the matters raised by the disability groups. But we also agree that the government is not able to do everything. We have also seen organizations that are responding to COVID becoming much more inclusive. And again, in the communities whereby persons with disabilities reside, there's a bit of more awareness, meaning there's a better understanding among the communities, meaning a better support system for persons with disabilities in the community. Now, the pandemic and the response for the same, I would actually say, has been a great learning for all of us. And actually, many of the learnings we are having or we are getting, we shall carry it over even after the end of COVID. Some of the learnings that we have been able to note as a region is that there's a great need to maintain our direct touch with the beneficiaries, because this is the only way we'll actually be able to know their real needs and at the same time respond on the basis of the responses that would actually get. Again, we've also been able to learn and again keep on learning the need to work and influence others, because alone as motivation, we are actually not able to do everything. The third thing that we have learned is the use of technology to do our work. In the days past, this was not 100% the way to go. But actually, we have come to learn that we can actually be able to do a support to persons with disabilities through technology, maybe over a Zoom meeting, whereby someone doesn't need to travel 500 kilometers. Of course, occasionally, people may need to do that kind of a travel, but we have learned that there's still a lot that we can actually be able to gather and generate over a short period of time when we take advantage of the technology. Now, to all of us who are attending this meeting today, this session today, I would want to say we are very thankful to all our partners and supporters who have made it possible for us to support our beneficiaries and our partners. Through your support, people with disabilities have felt valued and cared for. Food and medical items are in the process of being supplied. Authentic information has been generated and circulated. Peer-to-peer support has been possible, and it will be an ongoing thing. Beneficiary needs have been addressed through the referrals that we have made. Organizations and government have become much more inclusive. For now, just allow me to stop there, but we are happy, like Amanda did say, to respond to questions that you are likely going to present to us. Thank you so very much for your attention. Over to you, Amanda.
Thank you, Peter. That was hugely informative. And thanks to Catherine and to Anderson for sharing your insights. Please do remember, as Peter said, please put any questions that you have in the Q&A box, and we'll try to get to those later at the end of the session. But now it's my pleasure to hand over to Biju for your insights on the situation for the South Asia team.
Thank you, Amanda, for the opportunity to share about our work in India. A very warm welcome and thank you to all for joining us today. Motivation India is a South Asia regional program for motivation, and we have been working in India since 2010. Our work is focused on transforming the way wheelchairs are provided in the region. We partner with local NGOs, rehab centers, hospitals, and governments to build their capacities to provide wheelchairs conforming to the World Health Organization standards, and wheelchairs that are appropriate to the user's individual needs and environment they live in. Since 2011, we have provided over 18,000 appropriate wheelchairs across India, thereby improving the health, well-being, and independence of some of the world's most vulnerable and marginalized people. As Amanda and Peter mentioned, the COVID-19 pandemic has once again proved that persons with disabilities are forgotten and are often not on the priority list of agencies, both state and non-state, that provide relief support. In India, since the lockdown started in late March, the infection rate has risen exponentially. And as on date, we have 1.63 million people infected, but a significant number of recoveries at 1.5 million. However, more than the health impact of the virus, the economic impact has been extremely severe on the most vulnerable sections of our society, including migrant workers and persons with disabilities. At Motivation, we were swift in our response. We closed down our office in Bangalore and in Ahmedabad in the second week of March, much before the government announced the national lockdown. We ensured our staff has the capacity to operate remotely and are able to connect with colleagues globally using virtual meeting platforms. The next priority for us was to connect with our users and partners. We were swiftly able to deploy a team of 3 staff members to connect with our wheelchair users, parents, and caregivers over phone. And till date, we have talked to more than 1,500 users and are able to understand their situation and needs. And all our emergency response is based on this ground level feedback from our community. Based on the feedback we received, there were 2 major need areas where we decided to respond. The first one was to provide accurate and authentic information to our users. This is mainly to counter the false and misleading information that was floating on social media. Our team was able to curate information specific to wheelchair users and share it digitally and remotely with our users. Some of the information materials we developed, including e-posters on wheelchair sanitization, state-wise emergency helpline numbers for COVID support, domestic violence, and sexual abuse. The second need area was food relief to affected families. With the help of our partners, we were able to provide dry ration kits that would last for a month and safety items like face mask and soap to over 750 families. This would mean about 3,000 individuals across 4 states of India. And this was possible mainly because of our supporters. And I would like to thank our partners and donors, especially NTT Data and Cognizant, for their support. The need is huge, as we all know, and we continue our efforts to mobilize resources and partner with others to help disabled people survive this difficult time. To give you a little more detail about our virtual support to our users, I would like you to hear from our program manager, Praveen, in this short video.
In this pandemic situation, we started early response with our user community because we felt they really need our support because it's a sudden change. We're not sure what exactly our user communities, how vulnerable for them, because being a normal person, I know how vulnerable for them. So keeping that in mind, we communicating with our user community, our partner community virtually, and we're able to feel from user communities a lot of anxiety, a lot of fear for them that how they're going to cope up with this sudden change. So which made us to continue our virtual interactions. It could be with phone calls, it could be organizing webinars or Zoom conversations, a couple of things which made us, the need has been identified by user community. So keeping in this in mind, we understand there are lot more we can able to do for them virtually. So we're communicating and understanding their need, mobilizing that need to our donors and our well-wisher community, how much we can able to do it. All the need we may not fulfill, but how much we can able to fulfill, we contributing, providing them some dry ration kits, preparing some kind of safety and precautions measures, videos could be, or posters, or whatever the information we can able to do. Being an organization, we could able to help them. The parents and carers are also more vulnerable, more stressed in this particular time, where they have to handle them in home-based. So that made us how we can able to support parents group. So we started communicating with them in the Zoom, possible actions, how to maintain their assistive devices, importance of sanitization of their exercise materials, play materials, sitting on mobility devices, how they can able to manage within the home. And we could able to mobilize with help of our partners what importance of home-based therapy at present, which they can't able to reach to the rehab professionals, how they can adapt this particular situation within the home.
Thank you, Praveen, for that update. In addition to the above support, we continue to work with our partners to support our users to access various government support schemes. This is mainly for our users who are in remote rural areas, who are not aware of these schemes or were not able to register for these schemes. We are also working with our partners and developed safety guidelines for them as they plan to restart their wheelchair services in the days and months to come. However, there is a tremendous pressure and severe resource crunch for NGOs, leading to difficulty in retaining trained staff and availability of wheelchairs. Our virtual engagement with our users across different parts of India has given us never before insights into the use of digital technology in our work. We are actively exploring ways of using digital technology to provide services to our users that we would have otherwise done face-to-face. We are currently conducting a survey with our user community to get their feedback and understand their need in this regard. As we look forward into the future, we understand that rebuilding lives of our user community would be of paramount importance. The rise from the economic onslaught of the pandemic will be a huge challenge for persons with disabilities. At Motivation, we are committed to support wheelchair users in rebuilding their lives and livelihoods. We would collaborate with organizations in the livelihoods domain and develop joint projects. And we invite you to join us and support us in this initiative. I would end my speech with a short video message from Preeti. Preeti is from Uttar Pradesh, and she's a teacher and a wheelchair user.
Okay, my name is Preeti from northern part of India, Uttar Pradesh. And since 5 years, I'm using a motivation wheelchair and connected happily with Motivation India since 5 years. As we all know, this pandemic situation is very contagious. This disease is very contagious. We all are affected with this. And we, the person with spinal injury, differently able people, are more vulnerable to this disease because with more than some reasons and lots of reasons, more than lots of reasons, our immunity is low, our immunity is weak, and in this pandemic situation, I lost my job. My friend also lost their job. Like in past I run a coaching center for 11, 12 students. Now all things are shut down and we are bound to home, and our mobility is restricted. We all are a little bit depressed and feel anxiety. We are all feared with this COVID because this coronavirus is highly contagious. motivation helped us a lot. They conducted webinars. They conducted more than 2 to 3 times webinars to check the other person with disability in whole India. We 30 to 35 people connected to Zoom meetings conducted by motivation. Motivation are like a family to us, not professional, but family-wise. In this situation, we need a family more than a professional fee. Motivation comes forward as a mentor, as a family member.
Thank you, Preeti. And we look forward to your support. And I hand over back to Amanda.
Thank you very much. Many thanks to Biju, Praveen and Preeti. That was excellent. Gave us lots and lots of food for thought from South Asia. We've had some excellent comments in the chat box. Thank you so much for your positive comments. It means a lot to the team to have the support of this community for our work. Thank you also for the questions that you've been uploading during those 2 feedback sessions from Peter and Biju. I have a number of questions. I'll try and pick up as many as I can. Just to reiterate, if we don't get to your questions, please rest assured that we'll reach out and give you a response in due course after the session today. So Peter, Biju, if I can just address a few questions to you. The first question really is about the COVID support that we've been offering. Can you say a bit more about how long we're planning to continue that support? Peter, do you want to go first?
Yes. Thank you so much, Amanda. In terms of how long, I know this is actually a very difficult question because we find ourselves in a pandemic that we cannot actually be able to define the end for the same. However, in terms of our plan, we are thinking or we are planning until the end of the year. But going by what the government are talking to us about, there's a very high possibility that this is likely going to roll over into 2021. I have highlighted a case in point for Kenya, whereby schools will actually reopen in 2021 January, which clearly demonstrates to us that even for the government in Kenya, is likely not seeing the normalcy between now and end of the year. So for now, Amanda, I would say until the end of the year, we have got plans on what we need to do, but I will not be surprised if we will still need to continue in the coming year. However, there are 2 phases of the same. There's the actual response, but again, there is a second level, which is actually now rebuilding the lives as a result of the impact of COVID. So there could be those 2 possibilities. And that's what I would say for now. Thank you, Amanda.
Thanks, Peter. And what's your response, Biju?
I think I echo what Peter has just said. I mean, it's very difficult to predict the way the pandemic, the trajectory of the pandemic. From the numbers that we have, all indications are that this is going to peak in India over the next few months. So what we also envisage is that we would continue with our support, both our remote support as well as the food support that we are giving, at least till later this year. And we have also already started thinking of the second phase, which is the rebuilding phase. And that would go, simultaneously, working with partners, and donors and supporters in terms of developing a plan where we would be able to support our users to rise from this difficult situation.
Thanks, Biju. A number of the questions relate to Catherine and Preeti's videos. Clearly, livelihoods and the struggle to make a living are going to be impacting our service users quite badly now. I just wonder, could you talk a little bit more about the kinds of items that we're providing currently, and maybe just tell us a bit about how the partners are making those deliveries safely. Biju, can I come to you first this time?
Sure. See, our emergency support in terms of food relief. Now, we are doing this through our network of partners, and I know that there are a few of our partners viewing us today. So thanks to all of them. We are having a decentralized approach where our partners are sourcing the materials locally, and they pack it at the local centers. And our partners, in most cases, they would do a door delivery, and we ensure that our partner staff are safe. So usually they don't use public transport, but they would hire a private vehicle for the distribution. And we make sure that there are no more than 3 people who travel in the vehicle, including the driver. And they have all safety equipments like masks, sanitizers, gloves, etc. And they would deliver the products at the doorsteps. There are a few where the users would come and pick them up at designated points within the partner's premises, and they would time it appropriately, that there's no crowding in that areas. And the food materials that we are providing, we are not providing ready to eat or cooked food, which would make them, they would be worried about their second meal immediately or after some time. So what we are providing is dry ration kits that would last for a month, so that they don't need to worry about food at least for a month for the whole family. And this is not just for the disabled person, but for the entire family. Amanda.
Thank you. That question to you, Peter.
Yep, thank you, Amanda. For Uganda and Malawi, the approach would be more or less the same, what Biju has talked about, so I really don't intend to repeat. However, for Kenya, we have learned a method that the government is actually using currently, which is a cash transfer, which people can actually be able to convert that into food, into medicine, or to other necessities that would be required. So we are exploring on that approach, taking into consideration of the uniqueness of mobile money services in Kenya. So that's what I'd say for now, Amanda.
Thanks, Peter. I've had a few questions in the box about technology and access to technology and mobile phones. I mean, given that most of our service users are low income, could you just talk about how many perhaps have access to a mobile phone? Biju, can I start with you?
Yes, Amanda. Luckily for us in India, the mobile phone usage is quite high. I was just looking at some surveys and data that's available, which says that 77% of Indians have access to a mobile phone, which is quite high for our country. And the mobile phone tariffs are one of the lowest in the world. So in terms of affordability of a mobile communication device is quite high. And within our user community, the database that we have, almost 80% of them have access to a mobile phone. And the fact that at least one person in the family has a mobile phone. So if it's not the wheelchair user himself having a mobile phone, but at least there would be someone in the family who has a mobile phone. So the chances that we are able to connect to them virtually over phone is high. And from our data of our experience of calling 1,500 people, we have a 70 to 75% rate at which we are able to connect with our users. So that's a helpful scenario for us in India.
Thanks, Biju. Peter, is that the same situation in Africa?
Well, the situation is slightly different for Africa in the sense that not so many people have got capacity for connections. And again, we've also noted that for example, to do a Zoom meeting, you need to be on a smartphone. Not everybody would actually have an access to that. However, when we are doing the voice calls, majority of the people would actually be able to pick up those kind of calls. And in occasions whereby that is not possible, just because an individual is not able to purchase one, we have seen a very supportive Africa Family Network, whereby if a father has got a phone, it can be used by the entire family. So that is the approach that we are currently using, and we'll be happy to continue doing the same.
Thanks, Peter. Just while we're on the subject of digital technology, I know that we have been thinking about the use of Zoom potentially for reaching out to audiences in the longer term, and actually we've undertaken some of that activity now. Just can you say a little bit about access to a digital platform? So you talked a bit about smartphones then, Peter. How available is the digital network and that platform for our users? Peter, can you begin?
Yes. Thank you, Amanda. Just like I did say, the connectivity in Africa is not in the same levels of India. However, we have seen a huge percentage of people, especially the youth, who are actually going for cheap smartphones, which makes it much more easier to do meetings with them. And as I had mentioned in my presentation, one of the things that we actually going to look into is the possibilities of shortening some of the distances that we make, traveling for 500 kilometers, and look into the possibilities of actually doing a Zoom meeting with a service beneficiary and just confirm the status of how things are. So as of now, I would say the youth would actually be having that kind of an access.
Thanks, Peter. Question to you, Biju?
Yeah, Amanda, we are planning to use technology in a big way. And though COVID has forced us to look at technology and use virtual means of connecting with our users. And as I said before, we have already started a survey with our user community, with our wheelchair users, parents and partners and professionals to understand what is the need and how we could convert some of the work that we used to do face-to-face onto a digital and virtual mode. And when I say this, there are clear benefits, not only in the speed and in the agility in which we can deliver some of these activities, but also the cost. As Peter mentioned, most of the work which we would otherwise have done physically or face-to-face would have involved cost of our teams traveling long distances, traveling for days together. And those things can be now done virtually. And so going forward, we're going to use technology to a large extent.
Excellent. And lessons for our future in there too. Thank you. We've, as an organisation, we've been benefiting from hearing directly from service users over the past few months in a way that we don't normally have that privilege working as we do through partners. I wonder, Peter, Biju, with so much contact with users during the pandemic, were there any accounts of the impact of the pandemic that stuck with you? Peter, can we begin with you?
What I actually have noted, Amanda, is that with direct contact with our beneficiaries, as an organization, we have actually become much more responsive to their real needs. And persons with disabilities feel much more valued because they are involved in the entire process, whereby they can quickly describe what they are going through, but at the same time, they can be able to define areas of support. And at the same time, we can actually be able to measure the impact since we are walking the journey together. So going forward, this is an area that would definitely be exploiting of direct contact with our service users. Amanda.
Thanks, Peter. Biju, over to you.
In terms of our experience of working with, remotely connecting with our users, I mean, there's been, a mix of both negative and positive feedback. I mean, negative when I say it's more about the difficulties our users are facing because of various reasons, including loss of livelihoods, food, and etc. But I would, cite an example, and I would want to have a positive example here, because we all know that the pandemic has given us so much of negativity. And I would share a story of a little child called Panvit, is in Bangalore. He's a child with cerebral palsy and uses motivations wheelchair and accesses rehabilitation support from one of our partners. Panvit's father is a cab driver in Bangalore. Because of the pandemic and the lockdown, Panvit was not able to go to his rehab center to get his daily sessions. And Panvit's father lost his livelihood. He could not drive his cab. And they were in a difficult situation. Panvit's mother was part of our Zoom support. She was part of our Zoom trainings, which we did for our parents and helping them to start the exercises for their child at home. And because his father was a cab driver, he was never at home. I mean, he would always be out of home driving his cab. And so he could not see any progress in his child. And he was a little bit pessimistic in terms of the child progress. But because of the lockdown, he was at home 24 hours, looking at his mother, working, doing the exercises and things. And slowly he could see, small progresses, slight progresses in the child. And he was convinced that, his rehabilitation support was going on well. And he began to participate in these sessions with his son. And so I think, although it's a gloomy scene because he lost his job, the child was not able to go to his rehab center, but I think overall the family could come together. The father could be proud of his son's progress and the future. So that's what I would like to share.
Thanks, Biju. It's an inspiring story to leave us with. I'm incredibly sorry because we could have taken lots more questions, but we've come shortly to the end of our time. We've had lots of questions from you and lots of brilliant comments during the course of the discussion. As I mentioned, we'll try and get back to you with any unanswered questions from the session. I'm sorry that we only touched the surface of some of the questions that we had. And again, thank you so much for the kind of generous comments in the chat box. The teams will enjoy those. As I said, we're not a relief charity, but I feel very proud of the teams and the way that we've adapted our programming in a very short time to respond quickly to the communities that we serve. We're only able to reach out in this way, though, due to the many supporters who've helped to give us support during this time. As you've heard from Peter and Biju today, we worry that the pandemic has not yet reached its peak in Africa and South Asia, and the continuing infection rate numbers from India continue to worry and frighten us. And we're concerned about the impact on the communities, both to their health and their livelihoods now and for the longer term. We'll continue to provide support like this as long as we're able to, but we've been hugely grateful for the generosity and the flexibility of our donors, our supporters, and appreciate all the support that you have given us already. But if you are able or would like to extend or continue to support us, please be in touch with us, or you can go directly to our website and donate there. Just £30 could pay for food for a family for a whole month. So you see that every donation goes an awful long way to support our communities. That sadly brings us to the end of our event today. Thank you so much for attending and taking part. We've really enjoyed the session, and I hope you have too. To answer a question in the question box, we will be sharing an accessible version of the event with captions next week. So please feel free to share this with anyone who might be interested in hearing from Motivation. I think one of the positive outcomes of our new way of remote working is our increased ability to be able to hold international discussions like this with our community of supporters and stakeholders. After this session, we'd be really grateful to hear your feedback on the session that you've heard today, but also about what you might like us to discuss in future events that we might hold. Don't forget also to continue to have news of Motivation. You can sign up for our weekly newsletter or follow us on social media channels, Facebook, Twitter, LinkedIn, and Instagram. Please keep in touch. We are buoyed by your continued support and the contact that we've had with our generous supporters over this period. So please keep talking to us. Thank you once again for attending and for contributing so generously. Keep safe and enjoy the rest of your day. Thank you very much. Goodbye.